treated with ipilimumab and showing a survival follow-up of up to 10 years. Stephen, thank you.
Thank you. So I'm going to need, let me get to that. There we go. There we go. Very, very good. Thank you so much. And thank you everyone for joining, and thank you for the opportunity to speak with you this afternoon. So on behalf of my co-authors, I'm very pleased to share with you some of the pooled analysis of long-term survival data from a combination of phase 2, phase 3 trials for ipilimumab in patients with metastatic or locally advanced unresectable melanoma. So the original phase 3 studies had, for ipilimumab that became registrational, had shown a survival advantage, but interestingly had shown that a proportion of patients, the so-called tail of the curve phenomenon, that a proportion of patients seem to have a long-term durable benefit to treatment. And so what we're trying to do here is our objectives is we want to further characterize this long-term survival in patients being treated with ipilimumab with a longer-term follow-up. And so what was done is the primary analysis for overall survival was performed pooling patient survival data from 1,861 patients who were treated with ipilimumab in 12 studies. Those included 2 phase 3 studies and 8 phase 2 studies and 2 observational studies. This was done across different doses and treatment regimens, and with some patients having up to 10 years of follow-up. Now, overall survival, to try to remain consistent amongst these studies, overall survival was defined as the time from randomization of first dosing until death. And for those who were still alive, overall survival was censored on the last known alive date. An additional analysis was conducted with data from 2,965 patients from an expanded access program. This is a program that allowed the drug to be available to patients prior to a registrational authority approval. That would increase the total number of patients to 4,846. But this expanded access data was excluded from the primary analysis really due to incomplete collection of overall survival data. It was really whatever data was available at that time. So in the primary analysis, those patients were not included. So this is kind of the bottom line slide, and this is the Kaplan-Meier curve for survival. And what it shows is that right around an inflection point of 3 years, there seems to be a flattening, or it's the so-called tail of the curve phenomenon. So the median overall survival is 11.4 months, and the 3-year overall survival rate is 22%. And you can see that starting at 36 months or 3 years and going forward for up to 10 years, with lots of censoring be done before that, obviously. But there is that group of patients who maintain a survival advantage long term. And this is really the first data set that has followed patients with ipilimumab for such a long period of time. So when we looked at whether patients had been previously treated or had not received prior treatment, there was still consistency. So the median survival for patients who had not been previously treated was 13.5 months as opposed to 10.7 for previously treated, and the 3-year overall survival rate of 26% versus 20%. You can also see for both sets of curves and where things are censored, they both have the similar shape, and they both have this plateauing that occurs right around the inflection point of around 3 years. So when we do include the expanded access data, that we see, again, a similar shape to the curve, a similar inflection point. Here, the median overall survival data is 9.5 months. The 3-year overall survival is 21%. But again, even with these patients where the survival was a little bit hit or miss, the same shape of the curve, the same plateauing is seen with long-term follow-up, consistent with the other curves that I showed you. So to kind of summarize, this is a very large pool of patient data that is involving the overall survival analysis based on 12 different studies with more than 1,800 ipilimumab-treated patients with advanced melanoma. This shows that a plateau can be observed in overall survival that begins around the 3-month inflection point with follow-up up to 10 years. And this long-term survival did not seem to be impacted by either prior therapy, the dose of treatment regimen the patients received, or even when you include some of the data from the expanded access program with the caveats that I mentioned. So the all ipilimumab overall survival curve demonstrated great durability of survival, even relative to some historical meta-analysis or pooled from other historical trials in the cooperative group setting. And this analysis really provides further evidence that supports a durable long-term survival for patients who receive ipilimumab in the advanced melanoma setting. Thank you for your attention.
Thank you, Stephen. And before we take questions, we'll take the second talk and then open it to questions from the audience, and then we'll take questions